Please can you remind me, if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? But purple angel, purple angel, purple angel, you're next to
Hi everyone, it's Lori La Bey with Alzheimer's Speaks Radio, and I am the founder of Alzheimer's Speaks in General, which is a company that just tries to raise everyone's voice and share knowledge and resources with people all around the world from all ages and stages of life regarding dementia and caregiving. So thank you for joining us today. We're going to have a really interesting conversation about incontinence, and I think you're going to be shocked at some of the things that you hear and listen to about how we can get over this embarrassment and shame. You know, there's enough stigma out there with dementia. We don't need it rolling into incontinence, which a lot of people are dealing with as the disease progresses. So before I go there, though, I just want to thank everybody for listening and for liking and clicking and sharing our show. You have gotten us noticed all around the world, and with that, enabled us to connect with people all around the world and interview so many interesting people doing fabulous things. So thank you for your sense of community and your collaboration, and I hope you continue to click and share Alzheimer's Speaks Radio. If you're a business and you're looking to kind of expand your brand footprint, reach out to me because we have a lot of offerings through our radio show, through the blog, through Dementia Chats videos, our Dementia Quick Tips. There's a lot of different ways that we can help soft sell and brand you out there to a specific niche. And I'd love to talk with you further. Just go to Lori at alzheimersspeaks.com. That's Lori, Lori. I also want to just give a shout out to Keith Gallus. He's written this great book called Parental Dementia, a guide through all the difficult questions. And it's just a wonderful book for families starting out on the journey of caregiving because you know, Keith has been an executive director in senior housing for 20 years. And so he's heard all the tough questions that families face. And so he's put this book together, again, called Parental Dementia, a guide to all the difficult questions. And it's available at Amazon and Walmart and Barnes and Noble, or you can go to his site, parentaldementia.com. And there, if you use the discount code Lori, Lori, you'll get a discount for being our listener. So there's nothing wrong with that. But each one of the chapters covers a particular question, and I just think you'll find it extremely helpful. I also want to give a shout out to the Memory Cafe directory. Dave just does a wonderful job putting that together. We've got around 800 memory cafes now in the United States, and we know there's some out there that we don't know about, and we'd love to get them in the directory. It doesn't cost any money. And for those of you looking for support with your person who's diagnosed, and if you're a family member or a friend and you would like to go to the memory cafes, it's just a wonderful experience where you'll just get to connect with people like yourselves that understand, and you'll do a lot of laughing as well as a lot of learning and sharing. So with no further ado, I want to go ahead and introduce our guest today. It's going to be a really fascinating show, and I think one that is going to change a lot of people's perceptions about incontinence, which I think is extremely important. And so we're going to be kind of reframing what you thought of incontinence through Seni. And they really kind of give a facelift to this whole product line and get us thinking about quality of life by doing something a little bit different just to meet our needs. So first, I want to introduce to you Deanna Vigliotta. And she has 30 years experience in healthcare sales and joined Seni in 2019. And her goal is really to educate folks about the high quality adult incontinence products that they have. And I got to tell you, when I talked with her on the phone, I got off going, she's going to change the world. This is just amazing. She is so excited about this and has some great insights, I think, to get people more comfortable with the conversation and how they choose products and why. So Seni products are new to the U.S., so you might not have even heard of them, but they are and have been over in Poland, because they're a Polish-based company called TZMO since 1951. So they know their stuff and what is going on. So welcome, Deanna. How are you doing today?
Very well. Thank you, Lori, for having us here. We appreciate it.
Well, good. Next, I'm going to go ahead and introduce her sidekick sitting by her there, Lori Gridline, and she is with Benson Medical Equipment and Supply, which is a family-owned medical supply company based in Michigan. And Benson started in Michigan in 1953, and they currently have retail stores in Michigan and Florida. Lori resides in Florida, and her role has been account executive for almost 2 years. And Lori is going to add, I think, a lot in terms of, she's very familiar with all the different types of products and the differences out there with them. So welcome, Lori. How are you doing?
I'm doing fantastic. Thank you again so much for having us.
Well, good. I'm going to introduce our other two guests, and then we will get on with our line of questioning. Alan Bentley is an LPN and a clinical nurse liaison who proudly represents Tower Home Care and Rehabilitation Services, and he's been doing that since 2002. He serves as an educator to physicians, to case managers, social workers, and he really specializes in collaborating with referring partners and colleagues to provide patients with education and resources necessary to have optimal care in their place, so that they also have optimal recovery, because some people are in transitional care, some people are going to be dealing with incontinence long term, and all of those things matter. Ellen strives to reduce readmissions, which is like top of the tag list out there. So surveyors and communities and providers alike hopefully are really gearing up to hear about our conversation today. So welcome, Alan, and how are you doing?
Thank you very well. Appreciate being here.
Well, good. Next, I am going to introduce, sitting next to Alan is Tricia Ingracia, and she is a wellness director at Strive at Fern Park. And she has over 25 years of experience in nursing, which includes memory care, staff development director, resident services director, community liaison, long-term care nurse, medical office nurse. All of her titles reminds me when I was in healthcare, it was kind of that jack of all trade. And you just kind of kept exploring new roles. In her early career, she worked in a psychiatric intensive care unit at one of the local hospitals, but shortly after that, she really found her home in memory care. And it's kind of been a lifelong passion of hers. So her goal is to venture into other areas of nursing, but she's always returned to memory care. It just kind of seems to be her home there. So welcome. How are you doing today, Tricia?
I'm doing great.
Well, good. I am actually going to start out with the two of you, Tricia and Alan, because I always ask my guests one question before we kind of get into our main program, and that is, have either of you been touched within your own family circle or friends by dementia? And I'm going to have Tricia go first on that, if you don't mind.
Yes, my mother's side of the family has had a long history of dementia. From my grandmother to my aunts, her sisters. So yes, my great grandma.
Okay, great. And how about you, Alan?
As a nurse, I experience it basically on a daily basis to see, the hardship of the families and the difficulties that a lot of times the patients or the residents go through. From a personal level, I had a wonderful uncle who was diagnosed with Alzheimer's, someone who was very independent, very strong, supported his entire family, and I watched him basically reduce himself to where he could not do his ADLs, he could not help himself. He really became a shell of the person that he used to be. And I remember how it affected our family as a whole. And it's a difficult situation. But as nurses, it's kind of like, we're there to help and to bring light and education.
Wonderful. Thank you. And how about you, Deanna?
Yeah, on my dad's side, my aunt had Alzheimer's disease, and he used to talk with the family, and we'd get updates over the phone, but she was a woman who was a wanderer. And so, yes, on my dad's side, my aunt.
Great. And Lori, how about you?
Not personally touched by a family member, but absolutely by working in this environment. In a few skilled nursing environments that I worked in, we had a memory support unit. So I got a lot of education and learned all the little nuances about that disease. And it was very interesting. And of course, our patients and residents were just wonderful, wonderful people who unfortunately suffered from some of that. And, I would talk to the family members.
Great, thank you. Well, I want to get on with our line of questioning because, again, I think this conversation is going to be life-changing, hopefully, for a lot of people out there in terms of how they frame incontinence and just upping the ante in terms of their knowledge and their options out there. So, Deanna, I want to start with you. If you can kind of give us an overview of how many people with Alzheimer's are affected by incontinence, and even more importantly, how the heck does it affect them?
Yeah, so statistics from 2019, the Alzheimer's Association has reported in the US 5.8 million people with Alzheimer's disease. And out of that 5.8 million, 60 to 70% will go on to have incontinence issues. So you're talking about a staggering number of people, and then there were about 200,000 people that have early onset, and they're considered 65 years or younger, but the majority, 5.8 million and 60 to 70%. I always think of it, if you take those numbers and you break them down, what's staggering to me is with Alzheimer's disease and a person being incontinent, you're not only talking about the impact of incontinence with that individual, but you think of their caregivers, their spouse, their loved ones, their family members, people in health, everybody. And so to me, it's a wow factor of staggering numbers out there in terms of incontinence. And it's one of those things where a lot of people don't want to talk about it, don't want to plan for it, and then it becomes a crisis mode. And so the impact that it can have can be varied from people that are just starting to become incontinent may stay in their home. They're afraid to go out with worry, so they become isolated. That can be a big, issue. Pressure sores. If you're not in a good quality product that's not breathable, you can get pressure sores, and the ripple effects from that can be just staggering and worrisome and just not good. It just is, it's such an impact. And I think I'm learning with being with Seni, it's amazing to me, the caregivers. I always think of the person that's incontinent has their share of different things that will impact them in regards to it, but also those caregivers. I think about sleep deprivation. And I know myself, if I'm woken up every 2 hours, I would be a bear in the morning. And I think of the folks at home that have to deal with navigating other things, the healthcare system, financial concerns, everyday tasks, laundry, things like that. And I think, my goodness, if folks can get a good night's sleep with a good product, their caregiver can get a good night's sleep too, and hopefully together deal with the things that impact with incontinence.
Well, thank you. I think it's really good that you brought up the impact that it has on family, because it's, you're dealing with the stigma of dementia to begin with, no matter what type it is. And then there's a huge stigma with incontinence as well out there. So you're getting this double whammy. And the process, especially if the person isn't receiving, wanting to wear an incontinence product. I remember my mom I'm not wearing any damn diapers, she'd say, you know, and she'd get really mad. And I said, but Mom, you know, if we do this, you're going to be able to do a lot more things, you know, but it's hard sometimes when people don't have the ability to always, you know, put logic into play in terms of how that is handled. And I think people were worried about the big bulky look of it and everybody's going to know and on, which I'm sure we'll get into some of that, some of those myths a little bit later. Can you explain, Deanna, how choosing a quality product when it comes to incontinence can really make a difference for everybody involved?
Yeah, absolutely. It's really, really important to choose a product. I always think of it in the simplest of terms, that's breathable, meaning when somebody voids, if they're able to have a breathable product, the skin can breathe, and that is going to reduce risk of skin breakdowns and the pressure sores. So super important for that. Choosing a product that will allow you to sleep uninterrupted through the night with feeling comfortable, feeling dry, having moisture wicked away from the skin, all of those types of things will allow you to sleep through the night. That's a ripple effect into being able to tie in with what they call restorative sleep, meaning you can go through the different sleep cycles. And so when you awake in the morning, you're more alert. And you think, again, I keep saying ripple effects, but there are so many. If you're alert in the morning, your risk of falls is reduced. So you want to choose a product that's breathable, that's super absorbent, that's the correct size and fit. I hear a lot in the field, people will sometimes think a bigger sized product is better because it's going to hold more. And that's just a myth. The reality is you need it to fit correctly. And it will work correctly. Things I hear in the field, like people sometimes will think, well, if this isn't working for me, then I'll put an insert into the product. Again, we don't encourage that at all. We encourage the exact opposite. Wear a product that has the right fit, the right absorbency level, and you may wear one type of product during the day and one for night. For example, if you're more active, more mobile during the day, and someone's actually helping to toilet you through the day, that may be a pull-up type of product, as an example. And then at night, where you're into the good quality sleep pattern and you're more immobile, you may wear a brief at night, or different absorbency levels. So there's a lot more to it than just a package of products on the shelf and a price tag with it. There's just so much more proper fit. So you want to look for breathability, you want to look for super absorbency, you want to look for correct fit and size. Soft non-wovens with no plastic for comfort. Just to your point where you were saying, my mom, I don't want to wear that. Well, folks want to wear something that's comfortable, and one type of product for one person, we're all different, we're all human, may feel differently with another person. So all those things, it's just more importantly to get the discussion out there, help the loved one with the right product at the right time, and get them comfortable that they can go on and have their dignity as well. I'm very modest. And so I know for me, if I became incontinent, I would appreciate a product where I wouldn't have to be changed as frequently, and that gets into super absorbency of products because you've got more dignity maintained that way as well.
Wonderful. One of the things I had to giggle at, just in terms of process, my daughter, she had a baby, it was like 5 years ago, but after she had her baby, she was wearing pull-ups. And I'm like, what are you wearing a pull-up for? And she's like, oh, Mom, everyone's wearing them now, because the kids are like, well, hey, we're not messing with this stuff. We're getting on with life. I mean, the whole attitude was very different. There wasn't any of this shame or embarrassment that so many people feel. And so it's interesting as the generations change and in what their goals are, makes a huge difference. I want to go to Alan next, if that's okay. And I would just like to ask you, what can you share about the clinical impact on skin? Because we talk about pressure sores, but most families, I mean, that's not something that they've seen or that they're looking for. And like Deanna said, there's a ripple effect with all this stuff too.
Absolutely. I just want people to realize that urinary incontinence is not a disease. It is a symptom. And it can be caused by an underlying medical condition or a physical problem. And there are complications for people who experience chronic urinary incontinence. And some of those can be basically like skin problems and rashes, skin infections, excoriations, irritations. And people typically with prolonged urinary incontinence, they are a higher risk for repeated urinary tract infections. And we need to realize that urine is very acidic and is extremely irritating to the skin surface. And with our particular home health patients, it's imperative that for those patients who have coccyx wounds or buttocks wounds, that we keep the skin clean and dry, that we keep moisture away, keep urine away, so therefore it's able to heal naturally.
That makes a lot of sense. One of the phrases you used was, I think it was excoriation, and I don't know what that means. So can you explain that to our listeners as well?
Yeah, it's basically a skin irritation. It becomes red and angry looking, and it can be very uncomfortable. It's kind of like a minor burn, if you will. It kind of has that appearance to it.
Thank you. That's really helpful. I'm gonna throw the next question to Tricia. And because you're an RN and a wellness director at the senior community, what are your thoughts about the impact about dignity with residents and same with their families when they're dealing with this situation?
Well, it definitely impacts the dignity part. So let's go back to where when we're young, right? We're all taught to toilet train and be continent. And then as we age and we progress and go through life, different things change, our abdominal walls weaken, we might have some prolapse in the pelvic area or nerve damage, overactive bladder. All those things contribute to the cause of urinary leakage or incontinence. And some of those symptoms, as you said, are the urgency, you might be walking along, all of a sudden you gotta go. Or the stress one where you're coughing, laughing, sneezing, and you have some leakage. And the last one is what we see a lot in the facilities too, is the functional. And that means where physically you're just not able to get to the bathroom in time. You feel the urge, but you can't get there in time. So this causes the embarrassing moments for them. And they tend to recluse back into their room. They isolate themselves. They don't want to go out there. They don't want to have that embarrassing moment. And that's where a good quality product comes about. We can get them into something that gives them the confidence and can get them back out there doing their social activities. It improves their quality of life.
So
right?
one thing I want to ask you as the wellness director too, in terms of like activities and events, are there certain exercises that might be able to help strengthen, some of the abdominal walls and things like that? Is any of that kind of worked in? And again, that would be earlier stages when someone could follow directions and
Right.
and things. And I know that that's not the cure-all for everybody, depending on their situation.
Well, we encourage all our residents to get down to the activities, the exercise activities that we have every morning. And Towers is in our building here. So they have their therapy department who helps us. But ultimately, anything that would work with your core, your abdominal areas, that would help strengthen those muscles.
Thank you. I'm going to go back to Lori here, and I wanted to have you kind of touch on the importance of buying the right product. How the heck do you know? I mean, I think like when my mom was in a nursing home for 14 years, and as a family, we weren't asked to purchase those things. They were there, but there was like small, medium, and large. If you were lucky, that was your choice, and there wasn't any of this. Overnight, heavier flow, there just weren't options. It was kind of a one size fits all in 3 sizes, basically. So can you tell us a little bit about how people pick, and if somebody walks into your store or calls you, how do you guide them through this process?
Well, it's funny you should say that, because I can't tell you how many family members I have met that did not know where to go for their medical supplies and equipment for their mother and father. So we sell everything from medical supplies, meaning down to the medical tape, to the canes, the walkers, wheelchairs, incontinence products, all the way to oxygen, CPAP machines. So we are full service. As far as buying an incontinent product, very, very important to come into a medical supply store like Benson's, because a few different reasons. Number one, you have an educated staff. Seni has come in and done an in-service. So we do have other products on the shelves. But when Deanna came in and did an in-service to our staff, it was night and day from the other in-services, let's just say, because the way this product works, you want your loved ones to come into a store like ours versus the big box stores, or ordering online. When you order online or you go into a big box, I can promise you that staff is not going to be educated on that particular product line per se. Number two, they will not give you a sample to walk away with and see how the product does for you. We will give you the sample to go and try it, and then come back, and you might need a different size. We will measure. We will talk about what size is right for you. Like Deanna talked about, the absorbency is very, very important. So when people are going into the stores or ordering online, they don't know what they don't know, right? So they are going to order based on probably what their loved one has been using, and it just works okay, but it does not work as great as it probably could. So buying the right product at the right place is extremely important.
You know, it kind of reminds me of when I was younger, and even as you're older, you know, as things change, and this might sound really silly, but to me, it just kind of hit home, is just going and getting fitted for a bra. You can pick one off the rack, but you go get one fitted and you're like, oh, this is so much more comfortable. You know, I didn't know I was this size. I thought I was this size. I didn't, you know, and you know, it's those little things, I think, that can make such a huge difference with people. And or, you know, I think of dog food too. You know, well, this is what we've always gotten. What kind do I get? And no one's really ever asked, what kind should my pet have? It's just, I like the packaging of this, or I read this and it sounded good, but no one's really asked a professional. And yet it's something that you love and you care for so much. And I remember I had cut it out, and nowadays I would have just taken a picture of the dog food and go, okay, this is what I get, without thinking twice, without even looking at what is new or different out there. And so, you know, I'm assuming that your service is free when somebody comes into the store asking for information. Is that correct? Or is there a consulting fee at all?
No, not at all. You are correct. It's just like walking into a retail store. We function as a retail store. And we also have not only coupons for the Seni products, 20% off your first order of Seni products. We also have a little table set up where our staff can show the person how this product works, and literally pour the entire bottle of water onto the product and have them feel it after, 25 seconds, and show them how this is a superior product and here's why. And then we talk about a little bit of the nursing things that correlate into this product, like Trish and Alan were talking about. It's decreased risk of UTIs, decreased risk of, the skin breakdown, the wounds. It protects all that. So, and often it eliminates that from happening. It stops it from happening. So again, superior product, and the fact that we can literally show people how it works and why it's so important to choose a product with an educated staff.
Well, and I love that you brought up, the UTIs, because, sometimes it's a little bit harder, with grooming and stuff and to keep somebody clean, but we all have pretty much experienced out there someone with a UTI that takes the medication and then boom, it still isn't gone. And you're fighting that battle over and over. I hear that with families all the time, and now they're pushing to get actually like almost a double dose of the antibiotic to make sure that it's actually really gone, because it's not common for that. And yet with the readmissions to the hospitals and all of those things can be just horrible. And with the skin sores, I've not seen anything personal, but I've seen photos of people, and some of those skin sores they're just, they make you want to gag. They're so horrible. You can't imagine how much pain they're in. And then, the potential of, I would imagine, going septic in a situation like that raises. And I'm going to go back to Ellen and Tricia on this. Is that something that can happen for their body to go septic if one of those wounds isn't handled properly?
Absolutely. And with the elderly, they go septic very quickly. And something I wanted to elaborate on of what you mentioned is the fact that when you were talking about the elderly and antibiotics, a lot of times when you overuse antibiotics, you can become resistant to them. So when you truly need them at a later time, they will not be as effective. So in our arena in home care, we're seeing patients are being discharged from the hospital. I don't want to say prematurely, but very early on. It's the goal to kind of get them out. So from a home health perspective, we're seeing patients at a higher acuity level, meaning their care is very involved. Probably in home health, we treat from a nursing perspective, probably 40 to 50% of our visits are wound care. People with open wounds, and they're not necessarily simple wounds. They can be very extensive. They can be stage 3, they can be stage 4. And a lot of times with the elderly, they're already immune compromised. They have a lot of times vascular issues. Some are diabetic, and it really hinders the healing process. Mm-hmm. So especially with the Seni product that actually keeps the moisture away from the wound bed and away from the dressing, it decreases our visits, because the number one thing is that we see for coccyx wounds or buttocks wounds is a caregiver calling in and saying the dressing is saturated. The patient is urinated, they become incontinent, it's now wet, we need a nurse to come out and rebandage it or change the dressing. But with the Seni product line, what we've noticed is it keeps the moisture away for an extended period of time. Therefore, it really enables it's a benefit to the patient in the healing process, but also from a home care perspective.
Well, that's great to know. One of the things I just want you to clarify for people, you had mentioned wounds at stage 3 and 4. How many stages are there, just so families listening know?
There's typically 4 stages of wounds.
Okay, great.
And pressure ulcers and that kind. The stage 1 being the very superficial, to where the outer layer of the skin is affected, and then you have stage 4 to where there's muscle and sometimes bone involved. But now there's products such as like wound vacs, and we have come from the nursing perspective such a long way in treatment modalities, to where I remember early on in my nursing career, it was nothing to see patients for wound care 2 or 3 times a day. And now with these very advanced wound care products, you can see them, twice a week, 3 times a week, and you don't disrupt the healing process of the wound bed. So that's truly an advantage under home care.
Wonderful. And Deanna, I wanted just to ask you, because it sounds like you're doing a great job educating people out there and really making a difference. What type of feedback are you getting from, I would imagine you're dealing more with companies and staff versus families, is that correct?
I will share with you that I would say I've been doing this since April 2019, and it has been a little bit of both, calling on different communities, but also I've had the opportunity to present direct to consumer and share and educate at different events that take place and participate in different health expos. In fact, Lori and I have done some things together where we'll both educate the consumer, and they'll say, I like these, how do I get these? And then it will say, gee, you can get them over, through Lori's store. So I've had the opportunity to do both. And I think I may have shared this with you on the phone, and I'm not a young person. I have not received one negative piece of feedback with this product. It's almost too good to be true. And again, I'm not a young person and I've been around for a long time. The feedback is unbelievable positive and just true quick story. I was in one of my supplier stores a few months ago, and I had a name badge on, and the gentleman came up to me in the store and said, "Are you the Seni lady?" And kind of jokingly, I said, "Who? Yeah, maybe. Who wants to know?" And he proceeded to, without giving all the details, but he proceeded to share with me that he was probably mid-50s, but he had gone through bladder cancer, and he said to me, "Your products changed my life." And he said, I have to work. And I used to go to work every day worrying that I'm going to have an accident, I'm going to have a scenario. And he said, they really changed me. And that's when it kind of hit me like, I love this company. I love what I'm doing. I love the products, because what seems so, I don't know, natural or trivial or something that we just take for granted, it's an opportunity to change lives for all the right reasons. It continues to be an amazing journey working for this company. I just love every minute of it because they just care about quality, and they're passionate. My manager is passionate in her work. The leadership team is passionate. This company owns a community hospital overseas where under the umbrella there are many brands. The only one in the US right now is Seni, but they own a community hospital where the real doctors, real nurses, real patients are actually using and testing the product. So it's just a commitment to quality, and it's a lot of fun, and it's a lot of continued learning. And I don't know, I'm on the happy train these days. I am on the happy train.
Well, that's great. I want to ask you, Lori, in terms of when you're talking with families, do you kind of see the light bulb go off? I mean, because I would think if I'm hearing what you're saying, I would have been, oh, why is this the first time I'm hearing this?
Yeah, absolutely. Can you hear me okay? I know you just cut out for a second. From working in the skilled nursing facilities for several years, one thing that no one has touched on yet is the number of falls these patients have. Now, one thing that contributes to those falls a lot of times is they feel the need to use the restroom. Let's say it's the middle of the night and they can't see, it's dark, and so they might have a UTI. They might have just had hip surgery where they should not be getting out of that bed by themselves, unassisted, and going to the restroom. Well, with an inferior product, they're going to get up and go to the restroom. They're going to try because they have to go, and they do not want to go in the bed, and they do not want to go in the product that they're in. So that's a big light bulb that went off for me when talking to family members about, my mother always tries to make it to the restroom, and it's the middle of the night, and we've had a few falls in the past 6 months, and falls for the elderly can be extremely dangerous. And then you're talking surgery and everything that comes after that. And this product, literally, they don't have that urge in the middle of the night because they do not feel like anything's leaking, because the product is doing its job and it's wicking that away from the skin. So therefore, like Deanna said earlier, they're getting a great night's sleep and they're staying in bed. So that's very, very important for people to understand.
That's a huge thing. I was thinking of falls or just somebody slipping if it was leaking, but it's just that discomfort, or not hoping that doesn't happen, or not having to be cleaned up. I'm going to jump over to Tricia and Alan and just ask you guys, as far as you had mentioned some of the differences you see in the patients and the people utilizing these products, but Have you noticed any difference in terms of the resident on an emotional engagement level? You know, because a lot of times we can look at it from a medical standpoint, but you know, I'm always thinking about how do they feel, and is it affecting their attitude at all?
Incontinence definitely impacts their attitude and their emotional. You got to think about it. At one point, they were continent in their lifetime, and now it's a whole new onset of incontinence. And they're not only having to deal with that, maybe they have a medical condition that's, you know, making an onset come about. So they're dealing with a lot of different things that can contribute to the incontinence and the emotional part of it. The biggest thing is for us to offer a quality product and to offer the support to the resident and the reminders, you know, of the activities, and just letting that ear or holding the hand to, you know, get them to where they need to go and encourage them and get them down to the activities and keep them active.
I think, you know, Trish speaking on behalf of the assisted living residents. However, what comes to mind with me is the average Joe and Sally on a daily basis. I think that people who are younger, who are dealing with incontinent issues, it's something that's always in the back of their mind. You know, if I have a less quality product, is it going to leak through? Am I going to be embarrassed? It would really hinder sometimes the mobility of going out to go to social functions, because in the back of your mind, you're always thinking, am I going to have, is it going to show? Am I going to leave a spot or something like that? And I have to admit, I'm kind of a skeptic. But when I was given the demonstration of the Seni product, it changed my whole perspective of incontinent devices. I was absolutely amazed at when she took that entire cup of water and put it in that Breathe, and moments later I put my hand on it and you could not feel the moisture. I was sold. And I think of someone, me being continent and it affecting me that way, I cannot imagine how happy and fulfilled I would be if I had an issue of incontinence. That would be a lifesaver for me.
Excellent points. I have a question. I'm always looking when I hear about products of ways to expand usage and stuff. And I'm going to throw this one to Deanna. What about, you know, not everybody, you know, as their comfort level, you know, changes and stuff and their needs change. Could these be used for anywhere from menstruation to even, like, I know some people with hemorrhoids and they're worried about leaking. When you had mentioned about, is it going to show? I thought of both of those two incidences as well. Would it work with something like that versus just urine?
You know, they're very different types of products. Menstrual pads versus urinary incontinence pads, two different things, two different types of different, I'm going to call them liquids, but two different things going. So they're made differently, they're constructed differently. And it's interesting that you say that, because I don't know from a clinical perspective, but I will tell you from a Deanna perspective, I give a lot of thought to this. And I think people that are in their 50s and 60s and perhaps are just starting to even experience light incontinence, I am guessing out of habit, they may go to a store and they may pick up a menstrual panty liner, for example. And I question whether they get a UTI because that type of menstrual pad is typically not breathable and not made for urinary incontinence. And they get a UTI and they go to the doctor. And I wonder in our country if physicians are asking, gee, are you wearing any type of liner? I wonder if there's some tie-in, just Deanna's thoughts, if there's a tie-in with urinary incontinence and wearing the menstrual pad for the younger folks that are doing that. But they're absolutely two different types of products. And, you know, for your different needs, you should be wearing the correct one.
Well, that's really good to know. And that would be a great question for physicians to follow up, and for individuals themselves going, is there but again, when you don't know that there's even a difference between these other than you look, I mean, you walk into a store and it's just this size, this shape, you know, this, and it's, you know, light, heavy is kind of how they're weighing
Yeah.
stuff out, you know, trying to talk simple language to us, but all the real details of the benefits of the product really kind of get washed away because we don't even know what we're looking for, you know, in that. So thank you for that. I'm going to ask Alan and Tricia if they had anything to add to what Deanna said.
No, I think she covered it very
Covered
eloquently.
everything.
Yeah.
Yes.
Alan and Tricia, do you guys have any other comments of anything that we didn't cover that we should have covered?
No, I just think at the end of the day, it's nothing to be embarrassed about, urinary incontinence. It really is not. And, you know, people who are suffering or experiencing that, you know, you're not alone. You know, there are people out there who are experiencing it. And as Lori said earlier, you know, get plugged into a store, get fitted properly, you know, follow up, regain your self-esteem and your social skills, and don't let it be a hindrance or let it limit you in any way, shape, or form.
Tricia, anything you wanted to add?
I would agree with that. Don't let it limit your quality of life. Definitely.
Great, get educated. You know, one thing that we didn't cover, and I'll throw this back to Dina and Lori, is people are really worried about odor too. It's like, okay, so it's like packing this all away, but now it, you know, does the whole room smell or what's going on? I mean, because people think about those things. And so can you touch on that for people?
Yeah, absolutely. With the Seni products, I can tell you the way that they're constructed, different cellulose pulp, they call it, and polymers, and together they wick the moisture, create a gel, but it also reduces the urine odor as well. And so that is one of the benefits. And exactly to your point, people are concerned about it. And so that's where we're proud to say that we construct them in a way that it does reduce urine odor. And kind of our model is go out and enjoy life. Don't worry about it. We got you covered in that area, and you be you.
From assisting families in choosing a nursing facility, I can tell you that odor is very important to these families. And it should be, because if they walk into an assisted living or a nursing facility for their loved one, and they are literally looking where to place their loved ones, if they walk down that hall and they smell that odor, they're going to turn around and usually walk right back out. And that one's off the list. So it is extremely important. And I was fortunate enough to work at some places that kept it smelling very nice. And to go back to the Seni product again, it eliminates or lessens a lot of that.
Well, going down that fork in the road you just opened up for me, I got to ask this question. Okay, so you've got one on that is locked and loaded, and it's time to dispose of it. Do you have to dispose of it in a special way? You know, is it? Because people are probably wondering. You know, do you need, like with babies, we have like those diaper genies and things. Do you have to put it in a special plastic bag just to kind of keep it closed, or can you throw it in with your garbage? What do you recommend as far as that goes, Deanna?
Well, we have a product, and on the back of it, it's got a little tab on it. So for someone who is wearing a pull-up and they're out, they can actually roll it up, put the tab over it, and it kind of locks everything, and then they can just dispose of it regularly. So I'm not aware of any special measures regarding disposing of the product. But again, we try to construct them in a way easy on, easy off. Within the communities themselves, maybe Alan and Tricia might be able to speak to that, I should say.
Okay, we'll throw it over to them and see what they have to say. Alan and Tricia, any comments there?
For the disposal of it, the same as any other product would be, just wrap it up tightly and dispose of it as you would.
I totally agree.
Yeah.
Because, it's definitely soluble, it'll break down.
Exactly.
So therefore, any trash receptacle or anything like that, we wouldn't encourage you to kind of walk around with it for the entire day at SeaWorld or Disney World or
No.
something like that.
Okay, great. Thank you. Deanna and Lori, any last comments from the two of you?
No, I would just kind of comment further on Alan's point. Anybody out there that's looking for help, I love the word help in our country. I love the word help, but ask for help. There's so many resources out there, so many wonderful people. I think we're getting back into a world of people wanting to help people, and this is one area where speak up and ask for help, because you should be able to live a quality life at any age. And I think that's what I know everybody on this call is focused on. So that would be my comment. Ask for help. Help is out there.
To piggyback on that, again, we don't know what we don't know. And that's the way because as you're navigating these waters, you know, before mom fell and broke her hip, or before she became incontinent, you didn't know anything about those issues. So you didn't know where to go and what to do and what questions to even ask. So like Deanna said, ask the questions, because we're all going to be there one day too. So, you know, go to the people that know the answers. And before we got into this industry, we did not have these answers. So it's all about education, learning.
And I would imagine if they go to, let's say, like a medical supply store in their area that might not have them, mention it to them that this is different and that you've heard, and that they should be carrying this product and checking into that as well. Well, I think this has been a really wonderful conversation, and hopefully we've changed people's minds about incontinence and how it can affect your life, and how it doesn't have to affect your life, you know, that you can really continue to live a full life with this. But it is about getting educated, knowing your options, and getting the right product for your situation. And that situation may change over time too. The thing nice with Seni is they have such a wide range of products that are out there. So thank you again for your time today and listening. And I hope that you all will like, click, and share this so it gets out to the rest of the world there. And you can get a hold of Deanna, and we've got her email listed, as well as phone number and website there. And so please give her a holler if you have any questions, you know, whatsoever. We want to make sure that everybody knows about Seni, and that you get the right product when you need it. As simple as that.
Thank you.
Well, thanks once again for listening to our show. I think this was really powerful in terms of shifting perceptions of incontinence and products that are available and how to live more fully. So I hope that you choose to share this show with others and help those not only with dementia, but those that are dealing with incontinence as well. And all of our shows are archived, so you can access them anytime. And feel free to subscribe. We'd love to have you follow us. Bye now.